So this is going to be examination of the hip and groin. So we're going to start off with inspection. So we're going to just look at the overall posture, the alignment of the hips, if there's any pelvic tilt at all. Have a look at the leg muscle bulking, if there's any weakness. Expose the knees and look at the ankles as well. Just look for any obvious deformities. And then we're going to move on to assessing the gait. So if you could just walk up and down for me. And we're looking for symmetry again, and walk back. Any pelvic tilting, Trendelenburg sign, if there is any weakness of the gluteus muscles. And then also a sort of a general biomechanical screen. Could you squat for me? And then back. And then can you do a one-legged squat again? And we're looking for any pelvic instability there, rotation of the knee or ankle, and then the other leg, please. And that would be a good sign to look at any pelvic tilting again for gluteus weakness. Also, sort of to complete the screen, we're going to have a look at the shoes as well, the footwear, if there's any insoles, and have a look at the sort of the wear on the bottom of the soles as well. So once we've done that initial sort of screening, we'll then move on to looking at the spine. So again, we're going to look at symmetry of the spine, if there's any scoliosis, if there's any weakness in the paraspinous muscles, because that can obviously impact on hip and groin pain. And we're going to do a single leg extension test now to look at sacroiliac joint pathology. So if you could just come towards me, I want you to stand on one leg for me and then lean back, okay, good, and then back again. And then go on the other foot, please, and lean back, good. A positive single leg extension test is when there's pain on that standing leg, which compresses the sacroiliac joint, causing pain. So there didn't appear to be any there at all. And then to complete the spinal screen, could you just sit here for me? Just have a seat. So we want to screen the spine sitting as well. So again, we're looking at any deformities, any weakness of the muscles either side. And then we're just going to do a quick screen for movement. So if you could bend forward for me. So that's flexion, and then extend back, so lean back. Good, okay. We're looking at the lumbar lordosis, thoracic kyphosis, and cervical lordosis again. And can you just lean towards me? So again, that's lateral flexion, and then the other side. And we're comparing both sides. And then if you could turn towards me, so rotation, and then the other side. Okay, good. So we're happy with the spine. If you could just lie down for me. And again, just before we go on to the examining the hips, we want to just do a quick neurovascular screen. So have a feel of the legs, are they warm? Feel the dorsalis pedis, posterior tibial pulses, if they're equal. And then we're just going to quickly screen neuro. So if you could wiggle your toes for me, and then point your toes towards up, and then press down. Okay, and just bend this knee. Yeah, and then bend that knee. Okay, and then lift this leg up straight. Just keep it up. Good. And then lift this leg up straight. Good. Any pain at all? So we do a single leg raise. So just raise your leg to look for any sciatica, and again on the other side. Okay, good. And then just a quick dermatomal screen as well. So looking at all the dermatomes, if there's any numbness at all, we need to know about that. So we're happy with the neurovascular screen. We're just going to inspect again, look at leg length, any muscle wasting, if there's any internal external rotation of the legs there. So once we're happy with inspection, we've inspected standing and now lying down, we're going to have a good feel of the hip joints. So when I palpate, I like to palpate from anterior first, so feel the anterior superior iliac spine, and also the inferior superior iliac spine, which is where the abdominal muscles insert. We're then going to palpate along the groin, along the iliopsoas muscle, and also more medially at the pubic symphysis pubic rami if there's any pain there at all. So once we've had a feel anteriorly, we can feel medially now along the sort of the groin muscles there, and we can externally, just bend this knee slightly, externally rotate to expose the adductor muscles there, okay, if there's any pain. And once we have a feel there, we'll just have a feel laterally as well, so if there's any pain on the greater trochanter, that might be a sign of bursitis, so have a good feel there, and along the iliac crest as well. And then finally, on palpation, if you could just roll towards me, yeah. Okay, so we want to have, again, a feel of the greater trochanter, the ischial tuberosity, that's where the hamstring tendons insert, so if there's any pain there at all. And we can have a feel of the gluteus muscles, the piriformis muscles as well, if there's any pain there at all, so if there's any pain, no. Okay, good. So just while the patient is lying flat, we're going to have a look at active movement now. So if you could extend your leg back straight for me, so we're looking at hip extension there, so it's a good range of movement, and come back and then lie on your back for me. And then if you could lift this leg up as far as you can go, so we're looking at hip flexion there, and then if you could move your leg outwards, so that's abduction, and then move your leg back inwards and cross over this leg, yeah, so that's adduction, so really good range of movements there. We're looking at fairly sort of pain as well. And then so we're looking at internal and external rotation next, so could you point your foot outwards and then inwards, okay, and then bend this knee for me, and if you could just move that way, so that's looking at external rotation, and the other way, internal rotation. Okay, and finally the last test for active movements is just bend your knees for me, just bend the knees, and just let your legs flop out. So that's the knee bend out test. So again, that's looking at abduction, possibly a bit of external rotation as well. Okay, so then we want to just do that passively for the patient now. So taps hip flexion there. Okay. Abduction and adduction. We're looking at pain at end range of movement here, and then we're going to test for external rotation, internal rotation. Okay, so we're happy with the passive movements there. Just going to go into some more specific tests now. So we can flex the hip, we can adduct and internally rotate. If there's any pain there that the patient is experiencing, that's usually a sign of anterior impingement of the hip joint. So again, we want to compare both sides, again with all movements and these tests as well. So if the history suggests anterior impingement, we can do Faddeer's test, which is flexion, internal rotation and adduction. Faber's test, again, which is flexion, external rotation and abduction. So this is a good test for sacroiliac joint pathology, if they feel pain in the buttocks there. If they get pain in the greater trochanter when we're doing Faber's test or Patrick's test, that's usually a sign of hip joint pathology if there's pain on the greater trochanter there. Just moving on to another test as well, is Thomas's test, and this is to test for iliopsoas tightening. So if you could bring your knees both up and then hold them, okay, so we're flexing the hip fully there, and then the leg we want to test is keep hold of that leg and let this one go and straighten it. And put it to the bed if you can. So here there's no evidence of iliopsoas tightening. If the leg was unable to fully extend back, the hip, sorry, that would suggest that there's some tightening of the iliopsoas muscle. Okay, great. So that's Thomas's test. Just again, before we move on to some more tests, we just want to test the power of the muscles around the hip joint. So with the leg extended, can we flex the hip? So flex. So, and push against my hand. We're comparing both sides here. That's the test of the quadriceps muscle. And then with the knee flexed, push up, and that's to test for iliopsoas. With the leg extended, press down on my leg. So that's testing hamstrings there. And with a bent knee, just push down. That's testing the gluteus muscles there. Okay, good. So that's flexion, extension. Can you squeeze, press down? So we're testing adduction there. So we wanted to just compare that both adduction is as strong as the other. And can you press out against, so press out, try and press out. So we're testing abduction there. And again, that could be a sign of gluteus weakening with weakening abduction. And the last test that we want to sort of test for power is internal and external rotation. So just bend this knee for me. So internal rotation first. Can you push against my hand, press in? No, sorry, that's, yeah, so I want you to press out actually, press out. So that's, we're testing for internal rotation there. And then the next test is to test for external rotation. So we're sort of externally rotating the hip, so just press inwards. Okay, good, we're comparing both sides there. The piriformis muscle here within the buttocks is a very strong external rotator, so do that again. If there's any pain or tenderness when the patient is trying to forcibly external rotate, that could be a sign of piriformis pathology, piriformis syndrome. The last test that we need to do with the patient lying down is to test for a labral tear. Quite difficult to pick up and often missed, but this involves flexing the knee and holding it in one hand, and if there's an anterior impingement or labral tear, we need to palpate the anterior aspect of the hip joint and just try and catch the labral tear as we sort of internally, externally rotate and extend the leg down. If there's any pain catching, clicking during this, then that could indicate an anterior labral tear. The last aspect, so if you just turn away from me, if we want to look at the posterior, for a posterior labral tear, we'll just do the same. So palpate sort of the posterior, and internally, externally rotate and extend out and try and get a catching there. So that's for a labral tear. Okay, if you want to just stand up for me. The last few tests, I guess we can sort of screen. So we can do a hop test, which puts stress through the hip joint. If there's any pain on a hop test, especially palpation around the hip joint, that might signify like a stress fracture. So if you could just hop on one leg for me, and then on the other side. Okay, so that might sort of signify a stress fracture if there's any pain there. We've done our gait assessments, so I think that completes the examination.